Hi, welcome to All Things Home Care with Dana Arnone. I am a registered nurse with a focus on home care for more than 30 years. Each week we tackle topics and issues specific to seniors and the homebound. Today we are going to be wrapping up our season. With me are two contributors to our show, Mildred Gallery and Sean Serpy. Together we're going to discuss the stories that most impacted us. What people don't realize is week to week you see me in front of you talking about the issues that go on in home care, but you don't know that there are actually many people behind the scenes helping us to create and come up with these show ideas, and two of them are sitting with me right now. So really what I want to do is talk about, we're wrapping up our season, which has been very exciting. It's something that we've really been looking forward to, and we want to just talk about the shows that maybe some people didn't realize that we did, maybe they missed them, and really the ones that really you felt were so important. So Sean, tell me what show was most impacted you this season.
The biggest show, or the biggest impact for me, was the physical therapy show. That is for professional reason, also for a personal reason. The personal reason was that the guest star of that episode was my mom, who is in the last stage of dementia and was a home care patient herself. And we also had John Primavera, her physical therapist, there for that episode as well. And I loved it because it showed why physical therapy in the home is so critical and essential. Ambulation and gait are critical. Once a patient stops walking, once a patient no longer gets out of their bed or their hospital bed, it's only a matter of time before steep decline comes in. And being able to actually get a patient up to do basic exercises, to strengthen the legs, the calves, twice a week even, for a half an hour to 45 minutes, can not only prolong life, but also give a quality of life back to a patient who, in a lot of ways, as we well know with home care, gets written off. A personal example that I saw from it was that while incontinence was a major issue for a long time, because of physical therapy, because of the ability for my mom to get out of bed and to walk, and because her muscles were strong enough, she started to be able to use the bathroom again, which is almost miraculous if you think about it. It's not going to stop the decline. It's not going to cure dementia, but it's going to give a quality of life to people that they deserve. You know, my mom paid into the Medicare system for 80 years of her life. And, you know, the ability today to have a health professional come in and to be able to let her maintain some dignity is so special.
And I think that probably resonated with a lot of people too during that episode. That was one of my favorite ones too. So Mildred, which episode specifically was the one that you liked the most?
So for me, pet therapy was one of my very favorites.
I knew you were going to say that.
I mean, animals bring a comfort and a love that you can't get from any other source, and it definitely gives patients and anyone in the home something to look forward to when you know that an animal is going to be coming. As an example, so watching the patient that was 96 years old say that she looks forward to having the dog come once a month. I mean, she was there, as you said, with her daughter, that's there, her caretaker every day, but this is the thing that she looks forward to the most in her month.
That's going to be me when I'm 97, God willing. I'm going to be like, Mildred, send me the dog. Like, I want the dog. So I'm assuming that's the way you feel too.
Absolutely. I am an animal lover, and at any time in my life where I had surgery or wasn't feeling well, they bring me the most comfort. I mean, so do my children, but the animals...
Slightly different.
Yes, less grief.
Yes. Can't pet your kid.
Yes.
So for me, of course, my favorite episode was, one of them was the cooking show. Because someone who doesn't cook, you know, I don't pride myself on my domestic skills, I'm not gonna lie. But that, for sitting there learning about 3 ingredients, and you can make it look so pretty, and you can make it taste so good that even me, someone like me, can make, you know, a breakfast that is actually 5 stars. I was really amazed at his technique on, you know, bringing simple ingredients together, cooking it up on a hot plate. It wasn't even a stove, it was on a hot plate, a pan, a couple of ingredients, and you had a meal that that anybody homebound would, be thrilled to have. And it really translated towards all different languages because it wasn't something that you have to, really understand the language to make it. It was an egg, it was a steak, it was a piece of fish. And we cooked all 3 meals, I think, within an hour, which to me is pretty good. So I feel like if I could do those meals, anybody can. So that was one of my episodes. I loved
It was
it.
super impressive to me.
Yeah, I was impressed with myself.
Yeah, I like the fact that it was like having a restaurant in your home.
Yeah.
So a lot of the times our patients can't go out to a restaurant, and this is a way of us bringing the restaurant to them.
Yeah. And just the way that he showed how to display it on the plate, I was like, I can actually do that.
Yes,
So
yes.
Food, as I know from personal experience, is such a major thing for people in the home because that's what they look forward to.
But it's also, I have to say, one of the biggest complaints that we get from families is that the aide doesn't know how to cook certain meals. So I think that if they watch this episode, which I hope you guys do, and you realize that, if Dana, this could be my new motto, if Dana could cook it, an aide could cook it, because that's probably the truth. I mean, I'm not going to lie. That was one of my favorite episodes. One of the other things that I think was so important in that episode that it shows that there are certain schools like Home Health Aid Institute with Maria that they do take that extra step in teaching their students how to cook and prepare certain meals. They have a chef that comes in and teaches them very simple techniques on the hot plate and how to just make the families feel good about their meals and their meal planning. So I think that I have to say kudos to Maria and her school for really doing that, really taking that extra step in teaching their students, because I'm sure that impacts the families very well. Okay, so after the break, we're going to share some more amazing stories from this past season. So we'll be right back. Hi, welcome back. So we're going to continue our conversation about our favorite shows of the season. So we're going to continue now. So Mildred, I know we talk about all the shows all the time. So what was another one of your favorite shows?
Another one of my very favorite shows was Fair Pay for Home Care Workers, because we both know how absolutely essential and necessary that is. Because if we don't raise the pay for our home care workers, we won't have home care workers that are going to stay in this field. And this field is very essential to us staying home, safe, with care and dignity.
Yeah, I think one of the things that I liked about it was really you felt the impact of the efforts that people put into the Fair Pay for Home Care, and really it spoke to the dedication that people have to keeping it, a profession and raising the level of who enters it in and really giving them, it's, not really a decent pay. I mean, it's really minimal that we're asking for.
It was so, right, as of now, home care workers is the least desirable job, not because it's only because of the pay. There's nothing shameful about home care. The pay is the only shameful thing. One of the most important things that we were fighting for in Fair Pay was an increase of pay. And unfortunately, home care didn't get the full increase that we were hoping for and needing. So right now, as we know, and what we talk about all the time, what we know will help save people at home and keep this profession what it needs to be is to help with transportation. Transportation is another critical issue in home care. If we can give our home care workers free transportation, if we can provide that for them, they will go just about anywhere. A lot of the times we find in home care that they don't take jobs because they have to pay for transportation, and that comes out of their already meager salary. So what we're trying to do is to compensate maybe what they didn't receive from the government with transportation. It is our only hope in saving home care.
Mildred, when you talk about transportation, I think that people, and maybe they saw the episode, if not, maybe they can revisit the episode on Enid's story, where we actually followed a home care worker from the beginning of her day to the end of her day. And I think it really translates very well to what they go through on any given day. So to leave your home for 10 hours a day, commuting is 4, and you're working for 6. How is that? Who's going to want to do that job?
No one.
Nobody. If you don't watch Enid's story and that PSA that we work so hard on, and if it doesn't make you really rethink who enters this job, and maybe would you do that for your own family? Would you travel 4 hours to take care of your own mother? maybe, I don't want to say no, but I would say probably not. But yet that's what we're asking these workers to do, to spend 10 hours away from their families and be financially compensated for 6. You know, we saw her leaving, it was dark out, and we see her coming home and it's dark out. And that to me is not okay.
It's not fair.
It's not
and like you say, there are also areas here on Long Island that buses don't reach, so that they really weren't expecting to have people walking through these areas. And so these are the areas that that are we call them unstaffable, or the most difficult to staff. Not because because they don't want care, they don't need care, just because we can't get to them.
Yeah, you actually stole one of my favorite episodes, I'm just saying. Sean, what about you?
The in-person physical therapy episode, where they actually went into Bethpage to a physical therapy office and met with not only the physical therapy staff and took a tour of the clinic, but my favorite part, Dolores, geriatric patient. It was truly a great episode because you got to see how physical therapy benefits a geriatric patient.
And keeps her mobile, keeps her active. I mean, she's a spry lady.
79 years old,
Yeah.
and she's still working. And that gets back to the dignity piece.
Do we want to talk about the fact that she's working security?
That, let me tell you, that shows just the trust
know.
that a company has to have someone be in that role.
Yeah.
And part of that is being able to maintain the physical and the mental, but certainly the physical aspect. And this gets back to what we were talking about, the home care physical therapy episode. It's about allowing these people to age with dignity, being 79 years old and still having a job.
Yeah.
Still having a job with responsibility
Yes,
like
great,
security.
yeah, security.
And to hear her talk about how physical therapy benefits her and how much it has transformed, changed her life.
Yeah.
That just gave me goosebumps.
Yeah,
I
yeah.
love that episode.
What I like also is that physical therapy, you get to actually visually see when the improvement. And that lifts your spirits when you are improving walking, or even improving feeding yourself. So all of those things are important, and we need to keep our bodies in motion.
Yeah. Yeah.
If I could give a shameless plug, I want people to take a look at the allthingshomecare.org website. If you go
Please.
to allthingshomecare.org, and we have a donate button there for $1 a day. That's $365 in a year. You can make such a dramatic difference in being able to help home health workers get to work. In the case of Enid's story, to cut out 4 hours a day of commuting. Imagine what a gift you're giving to somebody who's getting back 4 hours of their day. How life-changing that is.
I had so many favorite episodes, but the one that actually was my all-time favorite, probably because it's where my career in the geriatric population started, was in the social daycare at Dayhaven out in Suffolk County. To me, and I think Waldo behind the scenes over there will tell you that I was in my scene, I had my jam because those were my people. And I just loved seeing people that would be stale at home, not doing anything, not into, getting relationships or talking to people, or just when we were making those dolls, and what it takes for someone with a cognitive deficit to be able to sit there and have the patience, or even to be able to have the dexterity to put that stuffing into that doll. I mean, that really keeps them going, keeps them motivated. And not just mention, when you're talking about how it helps the families at home be able to know that their loved one is secure and safe at a social environment where they're having their meals, they're having their their interaction, their socialization, the recreation, things like that, and they can go and live their lives. In one of the cases where the wife was going to work, I thought that was it was a home run, and it really made me remember how my career started. One of the other things I remember talking to the daughter, her mom was there, and her mom was considerably, demented. Conversation with her was not the easiest, But what the daughter was saying was that she's so stimulated there during the day that when she comes home, they actually have something to talk about. You know, they talk about, you know, they have, you know, they talk about current events at daycare and things like that. So where mom probably would have sat and watched television, didn't interact, and the daughter and her would have had the same conversation over and over again. At least now mom's at a program, she's interacting, she's social, she's hearing current events, and then when she goes home, you know, the daughter and her have something to talk about, which I thought was great as well. I think that people really don't give enough credit and support to the social and medical model daycares out there. One of the other things we also just want to briefly talk about is not only does Sean and Mildred help with the behind the scenes of our TV show, All Things Home Care, but they are on the board of directors. Sean is the president and Mildred is on the board, as well as many other people. But one of the things we really want to just do at the end of our season is to really do a hard ask for support. So with your support and donations, you can help us continue the fight for fair pay. You can help us with the transportation initiatives that we are, you know, really starting to put forth and really focus on a lot with the legislators. You can help with the education that we do. We run syllabuses here so that we really can bring the community into home care, starting with the nursing students. So there's so much that we offer through All Things Home Care that we really want to start engaging the public and really starting to ask you for some help. So if you have any questions, if you'd like to make a donation, you can give us a call, visit our website at allthingshomecare.org, and we would love to hear from you at any time. Hi, welcome to All Things Home Care with Dana Arnone. We are wrapping up our season, and with me is Davon McLennan, a senior nursing student at Farmingdale State College. We're going to talk about his experiences with the Reliance Nursing Clinical Rotation. So Davon, I'm so happy to speak to you today because you know, I'm all about home care and I'm all about nursing, and it makes me very happy and excited every time we have new students come through a clinical rotation. So I just want to know a little bit about you. Why did you choose nursing as your profession?
Well, I chose nursing as my profession because my grandma was actually a home health aide growing up. She took care of an elderly woman, basically Monday through Friday, 8 hours. And then my mom also got into the healthcare field as well. So healthcare has truly been in my family since.
It's in the blood.
Yeah, it's
yeah,
in
me
the
too.
blood.
Yeah.
So yeah, that kind of put me on track into the nursing realm, and then I just fell in love with it.
Good. So you're going to Farmingdale, so you're a senior now. So so how did you find the different rotations that you were doing throughout your experiences? How did you feel about them? So I know that they do med surg. So tell me a little bit about it with the clinical rotations that you did.
So each clinical rotation is basically a couple of weeks in that field. You basically act as the nurse, or you find yourself acting as an aide to see what the nurses do, because sometimes some floors are busier than others. But mostly being in the hospital, you're seeing how the hospitals run, how's the interprofessional team running, and you're just basically observing, or sometimes you get to practice a skill. Very limited though, but mostly you kind of hone in on your assessment skills and your rapport with patients within the hospital realm. So
yeah, and it's also opening up, I guess, your eyes at what you might want to do in the future. It's giving you a little bit of taste of everything. So you say, oh, I like that, I don't like that.
Yeah.
You know, like me, I was not a psych nurse. That was not my favorite rotation. But I'm very happy that they're starting to do community types of rotations, and Reliance being one of the sites now for Farmingdale State College. I'm always interested what people think about home care, before they come and then after they leave. So you had experience because your grandmother was a home health aide, but
Right.
have you ever gone to a person's home? Have you ever seen what happens within someone's?
prior to this rotation, no, I've never done that. I've always wondered, because you see in the textbooks, like, you can refer them to home care, but you just never get to that step. You never cross that bridge into the home. So it was very interesting to see, like, how home care takes place. And I didn't know much about it prior to this clinical rotation. I didn't know how much rules they have, the red lines, and insurance, or anything pretty much about insurance or anything like that when it comes to home care, and how hard it is and how underfunded it is. So it was an eye-opening clinical rotation. I'd
That's
say.
good. You know,
Yeah.
one of the things I really want people when they're going through the rotation as nurses is I don't expect anybody to say, yeah, Dan, that's where I'm going to go. As soon as I graduate, I'm going into home care. But I want you guys to understand what happens in the home so that when you're in, the med-surg units or you're working in a rehab center or wherever you end up and you're about to discharge someone home, you give a pause and you give a little bit of thought to saying, oh, I hope, wonder if this person has family. I wonder if this person has food in their refrigerator, because those are the things that we think about when someone's, in the home. That's what we deal with on the home care side. So tell me a little bit about the patients that you saw with through the rotation.
Patients that I saw were actually really sweet, super, super thankful that we were there. They like the fact that they have resources available to them, and that's something that's kind of key because not a lot of people know about the resources that are available to them through home care and through Reliance. So it's pretty, like dog therapy, for example. That's pretty amazing. Like
Yeah.
sometimes in the hospital they have like, some patients see dogs and stuff like that, but just in the home, some people who can't leave, or if they go to the hospital, especially with COVID, they go to the hospital, things can get worse or anything like that. So people truly don't want to leave the home.
So one of the parts of the clinical rotation that is one of my favorite parts, not only is sending the nurses out with nursing students out with registered nurses, so you get to see the home environment, you get to see the care plan, you get to see sometimes what happens as status post-hospitalization. Now they're coming home, they may be a little bit more declined, they may have a little bit more issues that they had prior, maybe medications have changed. You get to see the interaction between the patient, family, and home care worker, which I think is so important. But then you guys came back to the Reliance office, and then you had lecturers. So we always tried to have 2 different lecturers that every day that you guys were here. And one of the things that I really also want people to know, and maybe you can share your experience with that too, is that I feel anything that can be done in a rehab center or in the home, for the most part, we can follow up with that at home. And I think that the lectures that we offered show that, wow, you can do dog therapy. Oh, wow, you can have a podiatrist, or you can have a visiting doctor service, or you can have, Meals on Wheels delivered. So which one would you say, I already know the answer, but which lecture would you say really was surprising to you?
I feel like the one that was the most surprising was actually the Long Island Harvest, because I didn't really know much of, like, we offered pantries and stuff like that, or like even WIC. I didn't know much about those resources. It was pretty much just to see who was available to these patients and to these people who need home care. It was pretty eye-opening. I think the one that stood out the most, though, was Long Island Harvest, because they do so much work on the island, and they're
Yeah,
pretty
they're
much
great.
accessible
Yeah.
to everybody. And during these times, you may need things sometimes, and they're available.
And the thing too is that people shouldn't have to feel embarrassed by asking for some help, because that's what they're there to do. They feed over 5,000 people. Well, they bring food, I shouldn't say they feed. So they deliver it to the home, but very healthy meals that they can prepare. So that's one of the things that we do too, is we try to teach the home care workers, that when you're in the home, and their meals are very important to everybody, but specifically if you don't ever do anything, and if you're just in the home and you're isolated with this home care worker, you can look forward to a meal, and a nice meal. So that's that socialization for that home care worker and that patient is very important as well. But I hope that when we were done with our rotation, you guys left with some greater insight to home care. Maybe it's not going to be so fearful for you guys, and maybe you always will. Maybe eventually you'll say, oh, you know what, home care, I definitely see myself doing some, community work and really getting into the aspect of keeping people home.
Yeah.
So, we're home care and, critical care, we're very intertwined, whether you think so or not. So what they do in the hospital, translates over to the home. And what we do in the home can prevent a hospitalization. So I know that you were talking about going into critical care. So, and you're working now in a hospital.
Yeah.
So do a lot of nursing students end up working at Farmingdale? Do you find that there are a lot of them are doing work?
Yeah, a lot of us do work during the hospitals. A lot of us are aides. I'm not sure how many of us are like certified or whatever, but a lot of us do work at the
So
hospital.
you're getting your experience.
Yeah.
So that's good. Well, listen, I'm glad you guys were here. I was thrilled. We had 14 students, which is getting bigger and bigger, so that makes me very happy. Tell people, the nursing students that are out there, when you get to the point of your senior year, how does that make you feel?
Okay. So it's a mix of emotions when you get to your senior year, because, the whole time it's like, oh, let me go get your nurse. Hold on one second.
and
Let me
then
go
now
get
you're
your
the nurse.
So now that
Yeah,
falls
you'll be
on
there.
you.
Yeah.
You'll be right there.
It's scary.
But you know a lot more than you think you do. I would say that definitely. You know your basics. Everything falls back to the basics. And just provide the best care that you can.
Yeah.
The best patient-centered care that you can.
Very good. You know what I always say, and I would say this to you too, any opportunity that is afforded to you, you take it. Whether you think you're going to like it or not, you take advantage of anything that's offered, and it will only help you grow personally and professionally. Well, thank you, Davon. I really appreciate your time and giving a little bit of insight to your thoughts of the clinical rotation here at Reliance. That's all the time we have for this week. To learn more about how we are helping improve the home healthcare industry or to see any of our previous shows, please visit us at allthingshomecare.org. Also, please follow us on Facebook, Instagram, and like us and subscribe to our YouTube channel.
And remember that transportation saves lives.
And for just $1 a day, you can also save a life.
And please remember that there's no one more essential than those who come to care for us in your home. See you next time.
All Things Home Care elevates and supports home health caregivers by providing transportation and promoting education to better care for homebound seniors and the disabled. To find out more or to make a donation, visit us at allthingshomecare.org.